Back in the day when I first started and when I was training, there was basically no hardware for spine surgery. It was just starting to begin to have hardware for spine surgery. The incisions were much bigger. People stayed in the hospital a lot longer. Now the incisions have gotten smaller. A lot of stuff is done as outpatients, and hardware is much more prevalent, which aids in the fusion procedures. And also the microdiscectomy, micro procedures, or minimally invasive procedures have come a long way. And that decreases the time in the hospital, and it decreases the size of the incision, which sometimes can speed up the recovery process. Oh, it's changed drastically over 30 years. Most spine hardware for the lower back is made up of screws with rods that go between the screws. The screws go through a little small part of the vertebral body called the pedicle, and it's like putting it through a little small tunnel, and then the rods go between them, and what they do is they immobilize the spine to increase the rate of fusion. And then we also have the inner body devices, which are, they can be called cages, they call a lot of different things, but that goes between the vertebrae, and the fusion occurs through those inner body devices, and the two vertebrae fuse themselves together. So we can get a 360-degree fusion. By that I mean in the front and the back with hardware. Back when I was first learning, the only way to fuse the spine was to take a piece of bone from the pelvis, and you had to get just the right size piece of bone, and you basically wedged it between the vertebral bodies, and it couldn't be too loose or it would pop out, and it couldn't be too tight or you couldn't get it in between the vertebral bodies. And patients really couldn't move as much for a long period of time without a major brace on, because it had to heal before you would have to quit worrying about it popping out of place.